The pain of loss still cuts deep in the Philippines, 4 months after one of the most powerful and destructive typhoons on record killed more than 6,000 people. 13-year-old Jerome Nabong lost his home, which was built on sticks in the sea. He is among the 4.1 million people who were displaced by Typhoon Haiyan, known locally as Yolanda. Jerome was now living in a makeshift shack with his parents and 5 siblings.
Nahadlokira nanunuo. Kung nahangin makusog nanunuo. Ito. Tapos kung kuha na nanay, bakwit na kuno kita nanay. Kayo na kusog na kuno hangin suwad ba ito. Takaya ko, wari ko man anuan balay, wari ko man babayay. Kaya nakato ng mga gamit. Kaya bagulat to ng kahit na ng balay. Nagpabilin ako. Tapos dumako ng tubig. Dama naksamad. Kaya na akong mga anak nagburublag man. Aga man adto.
Jerome and his family are among the 930,000 people that UNICEF has restored access to safe water. In this case by giving them a water kit that includes a portable jug and water purification tablets. They also received a UNICEF hygiene kit with toothbrushes, toothpaste, sanitary napkins, and bath and laundry soap. As his mother says, though, beneath the surface, Jerome and his siblings are still very much traumatized by the storm. Bringing psychosocial support to children and teachers is a UNICEF priority in the aftermath of disaster. In the wake of Haiyan, UNICEF worked with partners to reach teachers, daycare workers, and education authorities with training on how to support children like Jerome who were affected by the typhoon. Some 17,000 children now benefit from 89 child-friendly spaces in typhoon-affected regions. Soon after the typhoon hit, UNICEF and partners set up such spaces across affected regions so children could have a safe place to play, learn key life skills, and receive psychosocial support toward healing and recovery. Part of a child's recovery is getting them back in the classroom as quickly as possible. To date, UNICEF and partners provided 430,000 children with learning materials in affected areas. Close to 153,000 children received backpacks and school supplies. The destruction of many health centers meant services were suddenly discontinued, including routine immunization with devastation of the cold chain and loss of vaccines.
As one of the first strategic decisions of the Yolanda for the UNICEF was that we should give priority to hard to reach areas. Because through our experience we know that there are the places that sometimes get neglected when it's coming to humanitarian aid. So that's why our strategic decision was that to more focus and more priorities on the areas. So our priority in UNICEF was that to make sure that the services, especially for the children and mothers, are available.
On the island of Panay, health teams are traveling to remote areas and going door to door, registering children for vaccines. Across the entire country, since November, over 83,200 children under 5 were vaccinated against measles and more than 82,100 against polio, while 55,300 received vitamin A supplementation in a campaign that also included screening for malnutrition. One of the mothers benefiting from the vaccination campaign is Ruth Catalan, a young mother who brought her 17-month-old daughter Jessica to this healthcare center to be vaccinated today. The typhoon took all of her family's material possessions, including her husband's fishing boat, and nearly took her daughter's life.
Kag natrap na kami to sa sulod sang balay, nakahingagaw pa kami paggawa sa gwa, nagdalagang kami to sa may puno sang kamonsel. Dito sa puno sang kamonsel may uhot to nga gatambak. Nagsaka kami to kay mataas naman sa pag mag-ano sang balod nga dako kay anamong balayway na to, naanod na to kay dako na ang tubig. Nagsaka kami to mga kuya dito, ginigot namon sa sa galon. Pinangamuyo kami nga maghuba na bala ang tubig. Kay way na kami paglaom nga mabuhay pa kami. Kag ang puya nasamad Arius na niya sang samad. Balat sang iya siki. Kag dako na mo pasalamat nga dayon ng tubig. Pero sige na namon tangis kay way nagigya kami may nabilin bisan na mga gamit sa among balay pati namon pangabuyan.
To document unaccompanied and separated children and to help return them whenever possible to their families, UNICEF has employed the innovative rapid family tracing and reunification technology. It uses an open-source mobile phone application to allow real-time documentation and information sharing, a more efficient, secure, and cost-effective method than the traditional paper-based system. To date, 130 children have been identified as unaccompanied or separated and are being followed up on by trained female police officers. The road to recovery in the Philippines will likely take years. Much progress has been made, especially getting children back in the classroom. But much work remains to fulfill the promise of child rights and to build back better. This is Thomas Naibo reporting from Tacloban, Philippines. For more information, visit unicef.org.